cases of coronavirus in Victoria since the beginning of the pandemic. That is 21 new cases since my update yesterday. 13 of those cases are linked to known outbreaks and complex cases. 8 are under investigation by our public health team. I'm sad to have to update you that there are now 757 Victorians who've passed away due to this pandemic. 7 since the last report, 1 male in their 60s, 3 males in their 80s, 1 male and 2 females in their 90s. 6 of those 7 deaths are linked to outbreaks in aged care. There are 89 Victorians in hospital. 8 of those are in intensive care and 5 of those 8 are on a ventilator. A total of 2,562,996 test results have been received, which is an increase of 11,952 since yesterday. Can I thank those almost 12,000 Victorians who got tested just a day or so ago? That's a really powerful contribution to our fight against the virus, and again, can I urge every single Victorian, if you've got even the mildest of symptoms, please come forward and get tested. It's how we can fight this virus, it's how we can get these rules off, it's how we can move and take those safe and steady steps towards a COVID normal. We've got to keep those test numbers up. We've got to have that certainty that the picture we're getting is an accurate one. It's very, very simple. If people don't go and get tested, then we simply don't have the information, all the inputs that we need in order to make very, very difficult judgments. Even with very high testing rates, they are still difficult judgments, but they become even harder if we don't have people coming forward and getting tested. So to everyone who has got tested, thank you so much. And to anyone who's got symptoms, the only thing to do, don't wait till Monday, don't wait a moment, go and get tested. There's more than 200 sites, it's a very quick turnaround, 90% of results are back within 24 hours. It's a massive thing that you can do, simple but so important. There are 4,274 cases with an unknown source, that's an increase of 2 since yesterday's report. There are 123 healthcare workers who are active cases, we wish them well. And we thank them and their colleagues for the quite amazing work that they are doing in so many different settings, every hour of the day. It's truly impressive, and we thank all of those health heroes for their dedication. There are now 834 active cases in Victoria, so that number continues to fall. In terms of the metro-regional split, there is 8 of the 21, there's 18 in Metro Melbourne, 1 in regional Victoria, and obviously a couple that are subject to further work, just to work out exactly where they have actually been, rather than what their address might indicate. There are 28 active cases in regional Victoria, so those numbers continue to fall, and it's a great testament to the hard work and the commitment, the perseverance of regional communities to get these numbers down and to keep following the rules. They're different rules, but there are still rules, and they have to be followed. And all the reports that I'm getting from regional Victoria throughout this week as they've opened up are very, very positive. But everyone has to remain vigilant, everyone has to continue to practice that good hand hygiene, go and get tested if you've got symptoms. All the different workplaces with rules, COVID-safe plans, they're there to keep you open. They're not there to close you down, they're there to keep you open. And if all of those steps are followed, if people take this seriously, and despite the fact that regional Victoria is in a very good place, the virus is still out there, even in very, very low numbers. So it's very important that everyone follow those rules and those steps. In terms of the rolling average, 5 September to 18 September, Metro is 39.3. Regional is 1.9. So this strategy is working. Those numbers tell a powerful story of what can be achieved when you stay the course. When you don't get sidetracked by some of the loudest voices, who I understand are hurting and want to open up. We'd all like to open up as quickly as possible, but we won't be open for very long if we don't first get these numbers down to a low level. And I think I'd say to everyone watching and listening right now, logic, common sense, international experience, our own experience shows us that you can't hope to keep numbers low until you first get them low. That is just an undeniable fact. And if we were to open up far too early, some would be pleased, but they'd be pleased for a short period of time, because we would simply be closed again not long thereafter. This strategy is working. These numbers today and this week, if you look back and think about regional Victoria taking not one but two steps, if you look at the numbers in Metropolitan Melbourne consistently falling, the 14-day average to be down at that level under 40 is something that every Victorian should be positive about, proud about, and very hopeful and optimistic about the weeks ahead. Can I just take you to aged care? There are 433 active cases in aged care. And again, by way of extension of my thanks to health workers, hospital staff particularly, there have now been 4,651 shifts worked in private aged care by hospital staff. That is an amazing effort on any measure, and we thank each and every one of them for their work. Just finally, before I ask Brett to add to my comments, some of you may know that this is today begins National Week of Deaf People, and I just wanted to take this opportunity to acknowledge that nearly 1 in 6 Australians have hearing loss, and it's important to recognise that as that's a challenge for many people in our community. I want to take this opportunity to thank personally and to acknowledge personally the work that our Auslan interpreters do. It takes many years of dedicated study to be as proficient, to be as expert as our Auslan team, and I just wanted to say thank you to them for the work that they do. It's about making sure that everybody's got the information they need and the confidence that single source of truth to take the right steps, to do the right thing, to be reassured and to get help if you need it. Before each of these briefings, I spend just a few moments with our Auslan interpreters and take them through what some of the things I'll be saying, and I've come to know each of them quite well over this journey, right back to the bushfires actually, and I just thought it was appropriate on this, the beginning of National Week of Deaf People, just to say thank you. I'll now ask the Chief Health Officer to add to my comments.
Thank you, Premier. I might start with an apology. I know that members of the Afghan community might have felt singled out by statements I made recently. That was absolutely not my intention. So sorry. I have volunteered a couple of times to work in Afghanistan in 1997 and 2003. It's a country I love and respect, and its people. So, Mazarat Meham or Wabakhay, I apologise. In terms of numbers today, it's fantastic to have case numbers lower than the temperature in Victoria. It's the first time in a very long time. So we are absolutely trending in the right direction. That's reflected in all of those numbers. Active cases in health and aged care workers, active cases in the community, and numbers in ICU and in hospital. So all very positive trends in that regard. I know that as we get to very low case numbers, there's a not unreasonable focus on individual clusters, individual outbreaks. It's not to say that they're backward steps. We have said many times that we expect it and that they will happen. They have probably happened at the same rate right through this epidemic peak, but we haven't seen them in the 700 a day. We haven't known the clusters that have been occurring right through the really significant time through this second wave, but they've probably been happening in much the same way right through this second wave. But we get on top of them, and the absence of new cases in Casey in the last couple of days is an indication that those pillars of public health response, isolation of cases, quarantine of close contacts, testing broadly, are absolutely the keys to stopping them. So if people feel that it's a threat, they get anxious, or they feel like it's a really significant backward step, I would say we should expect them, they will occur, but we know exactly how to respond to them. And when we've got such small numbers, we can absolutely give our focus and attention with the incident management teams that we set up, with the very significant engagement that occurs, and with the very agile response of the testing teams for pop-up testing on top of the very broad testing that we have in place at the moment. Happy to take questions.
Is the Casey cluster under control, would you say?
I would say it's under control. We will always look out over that 14-day period when the new cases can emerge. 14 days from the time of last exposure, so there's absolutely a possibility of additional cases. What we do know is that people are isolating appropriately and their close contacts are in quarantine, but people have obviously been exposed to the virus and they can develop illness anytime up to 14 days after having been exposed, but very few close contacts outside of the cluster that's known. So again, that's very reassuring from a control perspective.
Are there new cases in the cluster today? What's the total number of people that are in it now?
I believe it remains at 34, and for Casey local government area, active cases are at 67 today, down from 74 yesterday, so heading in the right direction.
Still 2 in hospital?
That I'm aware of, yes.
What had you said that offended some in the Afghani?
Well, I referenced my trips to Afghanistan, and I was reflecting on the fact that actually all communities across the world prioritise and care for those closest to them, and everyone wants to do the right thing. It inadvertently called out Afghanistan, which I think was inappropriate, but I was just reflecting on my experience of working with diverse communities internationally in humanitarian work, and the fact that there really is a universal human experience. We all want to look after our families, we all want to protect the broader community. I think that's the case across Melbourne. We need to enable people to do the right thing and to support them in doing the right thing.
The 2 people that are in hospital, can you tell us kind of their demographic and also what their condition is? Are they elderly people?
No, I wouldn't reveal those details for a small number of people in a local government area.
When you made those comments, you said that you were happy to go out and work with that community. Have you done that?
Yeah, I've been on so many Zoom calls working with different multicultural community leaders and representatives, so no different. I've spoken to communities across the board that represent various ethnic groups, countries of origin.
Do you think, without singling out that community, but in these minority communities, is the message getting through? Because obviously some of these communities may have a distrust of government messaging, given their background.
I think it is. I think the point I'm making is that there is a coming together of needing to try and enable everyone to do the right thing, and we know that there have been challenges in the workplace. The casualised labour, that means that people do some work in one setting and work in another setting. We know that there are challenges sometimes with testing. We can make an assumption that everyone can test easily because we've got testing sites, within 10 kilometres of almost anywhere in Metro Melbourne. But not everyone has a car. Not everyone can get on public transport, and so we need to do whatever we can. But I think we've found that when we work cooperatively and we really open our ears to what communities need, then we absolutely see people do the right thing.
So are you confident now that that is happening? Because I remember there was a couple of months ago you did say that the messaging hadn't been reaching everyone and that authorities weren't doing enough. So are you confident now that that message is getting through and it's just those broader issues that are the problem? Yeah,
I think we're doing more than ever before. I think it's a challenge. We've got literally millions of people with diverse needs across Victoria, Metro Melbourne in particular. But we are absolutely reaching in, and we are being as agile as we possibly can to understand what those specific needs are. So I'm very confident we're on the right track in that regard.
Are you also confident that you're getting enough information at those initial interviews now with people? Because previously there might not have been as much information forthcoming that you needed. Is that been rectified since the first wave and some of the issues that came up?
Yeah, I think we're always trying to work out the very best ways to do that. Again, it's a matter of trust and rapport, working with trusted counterparts to get information. And we shouldn't expect people to suddenly be forthcoming with information if the primary source of their information might be filled with wrong ideas. If news from their country of origin or in their first language or in their social network is all misinformation, we need to challenge that, and we need to make sure that we can cut in with correct information. So the fact that when you recover from illness, you can go back to your friends and family and your workplaces. That's a misconception that I am aware has been reasonably prevalent, that after you're cleared by the department, if you've had 10 days, 3 days without symptoms at the end of it, and you're recovered, you don't need to be ostracised from the community. You don't need to remain separate from workmates or extended family. There are other misconceptions that testing would or should affect your employment status or employment prospects down the track, or your visa status. They are completely incorrect, but again, they can be persistent ideas. So we just need to work with appropriate local partners to address that, and that's been happening.
Those misconceptions aren't isolated to minority groups either, are they?
No, totally not. There are many misconceptions out there, and we have worked hard to find all of those channels to meet people where they are, as it were, and to make sure that the references to correct information keep bringing people back to what we know to be the truth. But there are some very persistent misconceptions, and there are some people who are really trying to promulgate misinformation, disinformation, getting false information out there for whatever reason. So we need to tackle that head on as well.
What's the top of your list of the most frustrating misconception?
That coronavirus doesn't exist and doesn't kill people. I mean, that is just off the scale in terms of absurdity. Having seen infectious diseases in their worst forms internationally, having seen tetanus and polio and meningococcal disease, the idea that this illness that we know kills 1 in 3 people over the age of 80, to say that it's mild or just the flu or doesn't exist at all is really offensive to everyone who's lost a loved one.
Is there any plan going forward for the older people in our community to try to manage that? If there are outbreaks going forward once we open up and things start getting back a little bit more normal, is there any plan to manage that cohort differently to other age groups?
Look, I think the greatest protection for the elderly is to have low numbers across the board, is to drive transmission down to the lowest possible levels. But of course they're an especially vulnerable group, and so the restrictions on visitation to hospitals, even though that will change over time as numbers decrease, and the restrictions on visitors in aged care, and all of the things that we're doing in the aged care space in particular are those protections. For elderly people in the community, I think it would just be to really reinforce those protective measures that we've said for everyone. So, to keep that 1.5 metres distance at all times as they're out and about doing those essential activities of getting food and essential services, to wear a mask all of the time, to wear it properly. Hand hygiene, they're not special shielding mechanisms. I don't think we can say to elderly people just stay at home for weeks and weeks and weeks beyond everyone else getting out and about. I think they should be getting out and about as the rest of us do in coming weeks, but they need to be particularly cognisant of those protective measures.
People are allowed back in the home. Do you advise them still keeping 1.5 metres distance from family members, relatives that come over?
I think when you establish a household bubble, I think it's understandable that you can have close contact with those extended family members, the people you form a bubble with, but you should be free of symptoms. They should be free of symptoms. You shouldn't visit if you're unwell. You should test and isolate until you get that result. But these are our parents and siblings that some people haven't been in close contact with for literally months. And I think if you're well, then it's not unreasonable to have that human touch that everyone has been waiting so long for.
What about wearing a mask in that setting?
Look, again, it's a household setting. I wouldn't stand in the way of people who want to wear a mask in order to be precautionary about protecting others. Again, you can be infectious without the first onset of symptoms. That's not unreasonable.
Considering we know, for example, at home you're not wearing masks often, and we know this Casey outbreak, for example, happened really quickly through houses, is the home setting your biggest concern as we open up more, once people kind of get in that situation, they're more relaxed?
It really is. I mean, it's a combination of indoors, which is 20 times more dangerous, if you like, in terms of transmission risk than outdoors, and the length of time that you spend. So, if they're brief encounters indoors, as you get your takeaway coffee, it's much less of a risk. But if you're indoors for a protracted period of time, yes, that's exactly when transmission occurs. So people need to be aware of that.
That rolling average, 39.3, is heading in the right direction. Does it match the modelling that you were looking at, say, 2 weeks ago?
Yeah, it pretty much does. Again, there'll be things that we learn as we go along where the match isn't perfect, but it's very much along the kind of predicted models.
Can anything speed us up from 9 days, the next phase?
Everyone doing the right thing. We've said it enough, I guess.
Nothing will budge that date for the next easing.
I think we are always reflecting on where we're at on a daily basis. But we are more or less on track with what's been modelled and the indicative dates that have been laid out.
Are we more likely then to see something sooner than the 28th?
No, I don't know that we're more or less likely. I think we're on track, and that's a good thing. That's not to say that we shouldn't take the opportunity of these next couple of weeks to say this is literally the last gasp of this virus, if we want it to be, and to do everything we can to knuckle down with the things that we know have worked all through.
To get an idea of how you'll work in the future, this Casey cluster, for example, you now seem to know the people that are infected, you seem to have got on top of the close contacts. Would that be included in that 5-day fortnightly average moving forward, or would that, because you know who they are and things like that, would that be outside it?
Oh, we would certainly reflect on whether an outbreak is known, where the origin of it is, where all of those cases are isolated and quarantined. So we wouldn't, for example, if there were 20 cases in a day, that pushed an average up really significantly, but we knew that it was all contained and was essentially, almost the equivalent of one case. We would have that in consideration. We wouldn't necessarily say that's the same as an average of 10 cases a day because it's a big cluster or outbreak. We would really try and reflect on it as contained, controlled, and less of a concern than 20 sporadic cases. A mystery case, we don't know exactly what it represents, but it's more like 5 or 10 cases that we don't know about. That's the issue with mystery cases. It represents chains of transmission in the community that we haven't discovered, and that's why we'll always treat that differently than, and with more concern than a household cluster of 5 or 10 cases.
Do you know how many mystery cases we had this week, and how do you reflect on how that metric is tracking at the moment?
So they do get resolved over the next 48 hours, and we give them 48 hours to find whether there are close contacts who are becoming symptomatic. So they don't get resolved every day as I stand up here. But it's been 2 or 3 or 4 on a daily basis. That's much better than in previous weeks.
When do you actually make the decision about easing the next stage? Is it the day before the 28th?
No, we will try and give as much notice as possible. So we'd certainly be coming to that in the week or 2 prior to that date, not just before. But we have to bear in mind that anything right up to the lead up might change our view of that. We would not want to give either false assurance or inappropriate signals. We just need to see how it's tracking over time. But if it is doing what we think it's doing, the epidemiology, then we try and give as much notice as possible.
So if we're looking at the September the 28th, when's your moment of truth of pushing the button or not to ease it then?
Oh, look, it's a conversation between my public health team and Cabinet, Crisis Council of Cabinet, in terms of exactly when that determination's made, but it's pretty hard to talk about it in September.
There's been some frustration about the local contact tracing hubs not being rolled out as quickly as people would like. What is the delay there? Does that come from inside the department, or why does it take so long?
Look, I wouldn't call it a delay. There are really important things to get right foundationally. Well, they're planning, stakeholder engagement, structure, governance, the reflections on what's worked, how you scale it up across the board, the very significant differences across different local government areas in Melbourne. Our contact tracing teams have a rhythm to them and an operational nuance that is really working extremely well. Translation services, our work with Aboriginal community-controlled health organisations, lots of other elements that you can't just say, rolling it out locally across the board in X number of sites can bring that to bear instantaneously. So I think we should recognise that it's a really, really important measure to go to a local level of engagement, but it's even more important to get that right from the outset.
Is there an early indication that the testing sites in Casey, Dandon, and those new testing sites there have actually seen an influx as requested?
I don't think it's been huge in terms of numbers. Again, it'll depend on how many people have symptoms, but I think there's been a few hundred in the last few days, and we continue to encourage people to turn up at those sites.
Testing numbers more widely, almost 12,000 today. How are you feeling about, I know we had a couple of lower days this week in single figures. How are you feeling about testing numbers right now?
Yeah, it's decent. We're finding the cases that are out there, but you just never want a case to be out there unidentified. So again, urge anyone with a runny nose, a tickly throat, a sore throat, a cough, shortness of breath, fever, headache, muscle aches, please come forward, get tested. It's very easy, and you'll get a result very quickly now. And in no small part to the huge work that our path labs and all of the technicians and pathologists who work there, that has been kind of unseen work in the last few months, but as long a days as some of my public health colleagues have been doing, 16, 17-hour days in path labs to scale up capacity. It's been brilliant.
Do you know how many of those 21 are from the north, the northwest, the west of Melbourne, which seems to have been
it's still popping up in the usual suspects, Brimbank, Wyndham, Casey, a little bit more in Hume. We've had some in Hobson's Bay in recent days, as you know. So it's those same areas. But there are still one or two cases in other local government areas outside of those significant ones. But it's down to about a dozen local government areas, so it's contracting over time. It's a positive move.
Premier, can we ask you about, I guess, how are you feeling about the numbers?
Well, this strategy is working. These numbers are coming down because people are following the rules, people are staying the course. People, as painful as it is, are acknowledging the reality that we face. And just because we want it to be over, we just can't pretend that it is. We've got to see this thing off. And as I said at the outset, logic tells you, evidence, science tells you, you can't hope to keep these numbers low unless and until you get them low. You've got to first drive them down to the lowest level possible, and that means we've got every chance of finding that COVID normal and then locking it in. Not for a few weeks or a few months, but for as long as it takes until that vaccine arrives. Just on Brett's point about testing, I wouldn't want anyone out there to come to the view that, I won't get tested because that might bump the numbers up. We want people to get tested so we've got the clearest picture. That won't stop us taking steps because we'll know the stories behind those cases. We'll be able to bring not just a quantitative analysis but a qualitative side to it also. Cases are different, known cases, mystery cases, cases that are well contained, cases where we have real concerns. There are different types of cases. The greater fear and the greater likelihood of not being able to hit targets is if people don't come forward and get tested, because then we don't have that clear picture of exactly how much virus is out there. These numbers are solid, but there are people out there we've known all the way through. There are people out there who've got symptoms and they're not getting tested for whatever reason. I would just ask every single one of them who's watching, or any family member, anyone in your household who's got even the mildest of symptoms, please come forward and get tested. It's critical to their health, your family's safety, but also making sure that we've got the most complete picture and that we can stop the spread of this virus.
Why do you think they're not getting tested, those last few?
I think there are, well, hopefully I've addressed one of those reasons, maybe. The notion that I won't because it might bump the numbers up. That is not our concern. We want the most complete picture. That's far more important. And the moment you don't get what you think is a complete picture or a reliable picture, that'll have much more impact on taking steps than people coming forward and allowing us to find where the virus is, put a strategy, wrap our arms around those people and make sure that they're not infecting anybody else. That's that's critical.
But you have to know why they're not getting tested so that you can help them get tested, right? You must
Well,
have some kind.
again, there are many millions of Victorians, many millions of Melburnians, and there are many different reasons, I think. Talking with Gladys Berejiklian yesterday, they see weekend numbers drop, and they drop to a very similar amount to what ours do. They're open, of course, so they've got lots of other things to do. That might be a reason why they're doing those things and not getting tested. We're not in that position, but I just say to people, don't wait till Monday. If you've got symptoms today, get tested today. There's not long queues. You'll get tested quickly and you'll get your result tomorrow. And then if you are positive, you can take those steps to make sure that you're not giving it to anybody else. That's the strategy working at that really local, personal level.
I mean, the Mornington Peninsula is, because they've got such low case numbers, want to be separated from Melbourne.
I'm not here today to make any announcements about changes to boundaries, the boundaries between Metropolitan Melbourne and regional Victoria. These settings are about safety. These settings are about making sure that we all stay the course. And that's two or three cases we know of. There'll be more virus down there than that. That's just the fact. And it's really important that we all are as united as possible and that we just see this through. I would hope that's a part of Victoria I know very, very well, and it's a beautiful part of our state. And I know it's frustrating for people who might like to go and travel there not to be able to at this time. There'll be a time for that. But the key point here is that we don't alter things. We don't let our frustration get the better of us. We've got to see this strategy to its logical end, which is these numbers keep on falling, and then some of the most beautiful parts of the state will be available for all of us. That's the most important thing.
The Mayor of Mornington Peninsula and some of the businesses down there say that if they were able to open up like regional now, it would actually help them protect people in the future, in that they can kind of get their business models better, preparing for when
I
there'd
think
be
they'll
lots
have
of
adequate.
people.
They'll have adequate time to get their business models right. I don't. With the greatest of respect to, and again, people aren't required to necessarily agree with the decision, but the decision's been made, and we're not going to be suddenly changing boundaries and potentially undermining the entire strategy. I would have thought that people on the Mornington Peninsula would have welcomed some of the announcements that Victoria Police made this week about making sure that people from other parts of Melbourne are not going and travelling there. That is not lawful. That sort of travel potentially just means you're bringing the virus with you, and we don't want to see that happen. It's much like what we're doing in regional Victoria, where we are determined to make sure that only those who've got a lawful reason to travel from Melbourne to the country are in fact doing that.
Can you remind us again what police are doing to stop people travelling down to Mornington, for example? Because residents say that they think on weekends they see people coming down to their holiday houses and stuff.
Well,
How are we stopping
I'm
that?
more than happy to arrange Victoria Police to confirm for you in as much detail as you like, but that border point, that checkpoint, if you like, and even though it's internal to Metropolitan Melbourne, the sheer prevalence of second residences and back to the point about how beautiful it is down there, there's every reason to want to go there, but if you don't live there, you shouldn't be travelling there. And that's certainly feedback that's come direct from many, many locals. They don't want a situation where there's that discretionary movement, not that anybody has discretion to break the rules, that non-essential movement, selfish movement, frankly, that does nothing but potentially spreads the virus. As to exactly how many people they've got on the ground, how many cars they've stopped, I'm more than happy to get Vic Pol to speak to that.
What can you tell us about the plan to recruit retired police to help with enforcement as authorised officers?
Yeah, so we need more authorised officers to go and check workplaces, to whether they be high risk or low risk. More people out there making sure that the rules, which will be a feature of our COVID normal and our reality for a long time, albeit they'll be very different rules, they need to be enforced, and you need to have a balance of people that are doing that. And, whilst there's some capacity within the current Victoria Police workforce, there's never been more sworn members in our state than there is right now. Crime rates are much lower because people are at home. It would be logical to assume that the challenges police face in the months ahead will be closer to normal, as well as their COVID duties. More AOs are a really important part of that. It's not a matter of just targeting one group. Everyone will be employed on their merits. Everybody will be their background, their skills, and I expect there'll be lots of different people from lots of different backgrounds who are well qualified to do that work. So whether it's going to a meatworks together with some WorkSafe people, for instance, checking that that's working as it should, going to a pub or a restaurant and doing a head count to make sure there's no more than 50 people, all those sorts of things, that's very important. The rules don't work if there's no one out there enforcing them.
Are you seeking retired police?
I think that they'll look to all relevant skill sets, and there'll be some people who've had a role in law enforcement, there'll be some people who've had roles and responsibilities in every walk of life, I expect. They'll need a mix of skills, and that's exactly what they'll get.
Speaking of authorised officers, there's some concern in the community, particularly this week, about the Omnibus legislation. I know you mentioned it a couple of days ago and said it was to fix gaps. Can you elaborate on what those gaps are?
Whenever you're in an unprecedented event, no matter how well drafted, different laws were 10, 15, 20, even longer, 30 years ago, you'll always find things that you need to do better. So there's some things needed to be extended beyond the first Omnibus bill that we put in place, and then there are some other areas where, particularly I think when it comes to things like workplaces, when it comes to some in the community who may not necessarily want to cooperate. Brett just alluded to some of the quite just the fantasy that this isn't real that's going around and about the place. It would be naive to assume that every single person will be a willing participant in our public health measures. We hope it doesn't get to that point. But there are some people who, you can't explain it, but they have a very different view, and it's one that is detached from all reality. And all of us, the safety of the whole community matters. And that's why you don't enjoy having to make these sort of laws, but you've got to have contingencies in place so that some matters are put beyond doubt. Let's hope we never have to use any of those powers. Let's hope people are prepared to get tested and there's no need to be using some of the quite extraordinary powers that we have now and that we're seeking to refine.
What are some of the additional powers in that
I haven't got the bill in
legislation?
front of me, but I'll get you a list of all.
You must know.
Yeah. There are powers
some of them
around. There are powers around detention, powers around making mandatory and making absolutely compulsory some of the public health steps that we have put in place already.
When you say in relation to detention, that includes no limit on detention?
Well, you would always hope that you never got to that point.
But
if you've got someone who is infected and is potentially intent on spreading the virus rather than being part of a public health response to contain it, then you do need a legal framework to be able to deal with that. These matters will all be considered by the Parliament. They'll be dealt with. They'll be used very carefully. It's not a matter of anything other than planning for every possible contingency. They'll be used where appropriate, against very, very high thresholds. People don't easily move to a situation of saying to someone, well, I have no confidence that you will stay in your home for 14 days. I think you've got caught, for instance, multiple times, not quarantining at home. Well, then we're going to take some steps to put a framework around you so that you are not infecting other people and potentially setting everybody back. That's the kind of logic that sits behind it. In terms of all the different provisions, because some are extensions and some aren't, I'm more than happy to get a copy of I'll get you a summary of that.
Do you understand the concern about, for instance, being able to hold someone in detention? And I understand the example you've given.
Yep.
The concern in the community that that's quite a leap in terms of liberties of plucking someone for whatever reason.
Sure.
And
I can
without an
understand.
end in sight on the timeline for them.
Well, I think
locking
that
them up.
I think that's a highly unlikely outcome. I think that you need, though, to have those important protections there in the event that you need to use them. There's no, just imagine if, for the sake of politeness and to get some positive commentary from some who think this is a civil rights and a civil liberties, a human rights debate, it's a human life exercise. That's what this is. For the sake of politeness, if you didn't take these steps and then you found in a month or two that you needed those powers and you didn't have them, that wouldn't make a lot of sense. In terms of people's concern, what people are worried about and concerned about, I would have thought that the primary concern, in my judgment, the primary concern at the moment amongst the Victorian community is to get these numbers down and keep them down. And these measures are appropriate given that this is an unprecedented event. There'll be a time when they're no longer appropriate, and many of them in fact sunset next year.
Can you give us any more more?
questions.
Can you give us any more examples of kind of the criteria that would be used? Like you said, then if someone's been caught not quarantining multiple times, kind of.
It wouldn't be a politician making those judgments, but I'm happy to get you some other examples if you like.
Premier, if I could ask
They're a
you-
difficult balance to strike, but you know this is all on advice. This is not like, you know, I sat down and thought I'd draft a list of rules. This is advice, and there'll be some examples that are almost to the point where you would need these. So that gives you a sense of what might be there in the weeks and months to come. Again, I don't have the bill in front of me. If I did, I'd take you through it in more detail, but we'll get you that information. Sorry.
Thank you. Premier, just in regard to whether it be retired police or bringing more people into the force, forgive my ignorance, I'm not sure the training that a police officer needs to go through, you know, between graduating, but is there going to be a training process for people, because you're saying it's not just retired police officers, people from all over? How do we know that these
All
people
those
are-
authorised officers wouldn't be quite the same as a police academy experience, which from memory I think is 26 weeks, something along those lines. PSOs is less, police custody officers is less. Don't quote me on those numbers. I'm happy to find out for you. There'll be an appropriate training program. Be really clear about these people will work for the Victorian government, so they will be authorised officers. That means they have significant powers. They're used often in conjunction with Victoria Police if something escalates to the point where police need to be involved. They're significant powers, but they're limited. We think that there's an appropriate balance there, and again, if you've got rules, you've got to have people out there who can be in sufficient numbers to be able to enforce those rules. And hopefully, as they move through the community, they'll be able to see people doing the right thing, and we can all be confident that the rules are being followed up, that we're checking.
There'll be a rigorous process to make sure
Oh,
that
yes.
anyone who's taking on that job isn't
Absolutely.
someone who's not trusted.
Just as there is now for authorised officers, sheriffs, Corrections Victoria staff. There's a number of people in Brett's team from a public health point of view who have quite extraordinary powers, not just in a COVID-19 outbreak, but a Legionnaire's case or a food poisoning case or whatever it might be. Public health is here every day, and there are quite extreme measures that can be taken, because that's the risk to public health. If you don't do it, you can finish up with many people very ill on any given day in any year, and indeed you can have quite tragic consequences, as we see with this virus.
Premier, protesters are out again today and they plan to be out again tomorrow.
Go home.
How frustrating is it when you see the numbers this low?
Go home and follow the rules. That's a very simple message. Go home and follow the rules. There is no need to protest about anything, for or against. It's not safe. It just doesn't make any sense. You are potentially putting this strategy at risk. No one should be doing anything to contribute to the spread of this virus. 21 cases today. Seriously, this is working. We are getting there. And I'm so proud of all those Victorians who are doing the right thing. Let's not have too much focus on these selfish people, because it takes away from the mighty job, the amazing job that the vast majority of Victorians are doing. But be in no doubt, Victoria Police are not mucking about, and they will deal with these people, because it is a selfish act. It's an irresponsible and unlawful act.
In relation to the cluster there at Casey and
Yes.
Dandenong with the 5 households, I know yesterday you said that these families weren't going to be fined, even though they broke the rules, because you wanted to get information from them.
Correct.
Why can't you get information from them and give them a fine?
Well, let me go back through this again yesterday, and I'm happy to concede that might seem a counterintuitive point, and perhaps we'd all feel a bit better if they got slapped with a fine. But the value of the information that allows you to take one test result and then find the 33 other people who've got it is much more than $1,652.
Why not fine them as
In
well?
fact, it is, well, because I think that if you start doing that, you run the very real risk that people are not full and frank in the interviews, or indeed some people may not come forward and get tested if they fear that they can't do that in an open process. If we were to try and do a kind of retro analysis of every one of the now close to 20-odd thousand interviews that we've done, through the course of those interviews, many people in many different ways will have essentially admitted to doing certain things. And it's about trying to balance up. You know, we might all feel better if those 5 families got a fine, but ultimately the value of the fine is nothing compared to the value of the information that they give us. because that's how you pull it up, that's how you drive the numbers down, and that's how we get to a point where these rules won't need to be on.
You understand how it looks to some, it might look to some that if let's say I broke the rules and got COVID, if I broke the rules and didn't get COVID, I'd be fined.
Yes.
Yet here are these people breaking the rules, getting
Well, I
COVID.
understand. Believe me, the frustration is a shared one. But again, that's where you've got to just take a step back and think these things through. And
You think
any
they
sense of
they might withdraw their cooperation.
Well, any sense of satisfaction that we might collectively get by these people getting fined would be very short-lived, because ultimately what's most important is getting the information out of them and people feeling that they can be frank and honest and truthful. As I said, if you went back through the 20,000 plus interviews we've done over the last year, through the course of those interviews, people will have made admissions, large and small, about their conduct. And the value of that information far exceeds any fine. Far exceeds any fine. It's also, can I say, they'll be talking about what they've already done. So that behaviour can't be changed. Fines and penalties and enforcement is not about trying to change things that happened in the past. It's about trying to make sure people have a motivation to do the right thing. And that's the vast majority of Victorians are. The vast majority of Victorians are. What you'd never want is a situation where somebody decided not to get tested because they felt that might lead to them, there might be some sense of stigma or shame or a financial penalty for having got this thing. Doesn't discriminate. Postcode, faith, no faith. Where you were born, how big your house is, how big your bank balance is. It doesn't discriminate. Neither does our public health response. And the value of the intelligence that we get from people who are frank and honest far outweighs all the fines in the world. Seriously, this is about getting the best information to drive the case numbers down. And that's why we make a frustrating sometimes, a difficult sometimes, judgment that the information is worth an absolute fortune, because it means we can open up and start to repair the economic damage this pandemic's done.
Speaking of fines, do you know if anyone's copped that big one, the 5,000 for leaving Melbourne?
Not that I'm aware of, but when we're following up other matters with Victoria Police, we're more than happy to check that for you.
Can I just ask as well, the town of Little River towards Geelong is hoping for that regional boundary to be shifted. Are you considering that? Is there any updates on that?
Well, I saw some comparisons drawn between Little River and the Mornington Peninsula, which I don't know is particularly fair. Little River is a very small community, and I think we're still looking through that issue and seeing what we can do. That'll be a matter of what's logistically possible for Little River, and Victoria Police would make those judgments. The Mornington Peninsula is an infinitely bigger community, I would have thought.
On aged care, is this the feeling that they should be in lockdown until they have a vaccine?
No, we'll have to assess that as we go through. I was asked a question yesterday about, is it likely that there'll be some limits? There'll be the notion without a vaccine or very rapid point-of-care testing, so that notion where you can take a test and get your result 30 minutes later. Without either of those things or some other therapeutic that happens to be developed in the next weeks and months, older people, particularly those who've got underlying health conditions, are going to be at real risk. And that's why there'll have to be some of the settings, not necessarily all of them, some of the settings will need to be maintained. And that'll be the same for hospitals. They'll change and they'll be appropriate to the risk at the time. But as Brett just said, and I think I've made a similar point myself many times, the best protection for vulnerable people in the community is to get these numbers down to very small levels and then keep them there. That's the best protection for anybody who's got an underlying health challenge, whether they be a child who's got complex health needs, someone in their 20s, 30s, 40s, or someone who's very frail and aged. There are many vulnerable people in our community, many, and they're not only those who are in that last chapter of their life. Then, of course, there's the not insignificant matter of people getting this, otherwise healthy, and you don't shake it. You don't shake it like a cold. It's there, and there's a lasting impact, like a chronic illness that you've got to fight for a very long time. And then there's some very worrying stuff coming out globally about particularly people who are in fact super fit, and there potentially some significant permanent damage to them. That's the nature of a novel virus. I think I've been faithful to that. A novel virus, you don't know. You don't have an absolute certainty about what the impacts are. That's why I keep saying to people, we've got to stay this course, because no one wants to get this. No one should be kind of it's fine, doesn't matter. And I see all this commentary about, 99% of people get better. Well, what's better? We don't know. We actually don't know, and we won't know for quite some time.
Do you know anyone who's had it?
And a few people, yeah.
Mates?
No, not friends or family, but I know a number of people, colleagues in the broader sense, so people that you might deal with that have had it.
On Mornington quickly again, if there's very little or no cases in that area, and you could theoretically move that police border up, so you open up Mornington and also kind of close in that area of Melbourne, why not do that?
Well, we've got a border there that, as I understand it, and that's why I don't want to be absolutely definitive, because it is very much a matter for Victoria Police, but at the announcements that were made the other day, as I understand it, a feature of those is to have that as a permanent checkpoint. So it's there for everybody. Now, that's not in recognition that Mornington Peninsula, that its status needs to change from metro to regional or vice versa. It's a recognition that it's a beautiful place, and news. It's nothing I've done makes people want to go to the beach. That just happens, right? That's just a feature of the fact that it's a beautiful part of our state. And the other point that's beyond all of our control is there are many second homes down there, and we need to be careful. And that's directly from feedback from people in those suburbs, those towns, who've been very clear to us that they don't want people coming down for day trips, bringing the virus with them. That'd be against the 5K rule anyway, and it's not shopping, it's not essential, it's not in accordance with the rules. So given all the wonderful features that might attract people into that community, and that would be against the rules, there's a checkpoint there. As I understood it, that's now going to be a permanent feature, and there'll be more cars stopped. The exact nature of that, though, we can get VicPol to follow up.
We're speaking with Brett about 9 days away, the next phase of easing restrictions, fingers crossed.
Yes.
We're heading in the right direction. Do you have a sense of when that decision will be made? It's Monday week. You need to make a decision by Wednesday?
Well, the way this works is the public health team provide their advice, and they'll provide early advice, then they'll add to their advice. And again, we've made the point very clearly that that modelling is very important, but the actual data, the case numbers every day, the investigations, the narrative that sits behind each of those numbers, that's really important. So you would make a decision as significant as that as close to the time that it came into effect. But the decision-making process is not, I wish it were, it's not one meeting, and it's not one person. There'll be a bunch of us all sit down together, take advice. That advice will develop and unfold throughout the week. That's one of the very difficult parts about this virus. I don't know what tomorrow's numbers will be. I don't know if there's going to be a big outbreak next week in a very high-risk industry. I don't know whether there's another Casey, whether there's another five families out there somewhere. So you've got to be as contemporary. Use all the data you've got as close to the decision point as possible. So I can boldly predict for you that there'll be meetings throughout the week and well into the weekend, next weekend that is.
Wow, so it could be Saturday or Sunday before.
Well, that's the way it's always gone. Yeah. We always sit down and work through these things, and you get as much information as possible. And the passage of time is in some ways, well, it's very frustrating, but the most recent data, the most recent inputs is a really important part of that.
Brett was or you both seem to have been pretty steadfast this week that the 28th is happening. We know what's happening on the 28th of September. Is there any prospect of that
provided
changing?
Provided we're within 30 to 50 cases, and we are now, and our expectation is if everyone keeps doing the right thing and stays the course, keep getting tested. If you've got any symptoms whatsoever, as soon as you feel those symptoms, then we're confident we can take that step. But we were very clear at the time, the case ratios or the date, whatever came later. That's what we were very clear about, particularly for this very early step. It's very hard to predict where you'll be at the end of October or at the end of November because there's time that has to pass. And as we all know, a day or two in this, it's like six months. It's just the practical reality of this.
I have to ask as well, 21 cases a day and the weather's getting nice. Any prospect of a day off for you soon? Or
whether it's good weather or bad, we've all got work to do, and I'm very focused on that task. Are there any other issues? If not, thank you, and we'll see you tomorrow. Oh, sorry.
question, just a follow-up from a
certainly.
colleague. Just in relation to some information that he received from the Department of HS about a cluster, 27 people at a gym previously in the last couple of months. I think the information came to hand in line with the fact that we were asking why is it until late November until gyms are reopening. Do you have any information about whether there was an outbreak at a Melbourne gym at all? Or?
I'm not aware of a cluster of 27 cases from a Melbourne gym, but we look to other jurisdictions' data on gyms and some of the really tricky issues to address, the shared equipment. You know, you can have fantastic cleaning regimens in place and good oversight, but people are exerting themselves. It's an indoor space. They're there for more than just a few minutes, and there are a number of places internationally where gyms have been shown to spread the virus. So I understand, again, people are really keen to open up. People who manage gyms want to do absolutely everything in order to get those businesses up and running. But the outbreaks that have occurred have also occurred in places where they're doing all the right things that you can to try and mitigate it, but it is inherently more risky for all of those reasons. Strenuous exercise indoors, potentially protracted periods of time.
And that's more risky than being in a swimming pool?
Yes, it is. You know, I think there's a greater density of people. There's clearly shared equipment and surfaces that, you know, individuals might wipe down between use, but not everyone will. And it's a tighter space in terms of an indoor space.
Just on that end of the month thing again, sorry to keep coming back to it, but the target is between 30 and 50. We're at 21 today. What if we're well under 30? Do we get more?
Look, in terms of what happens after the 28th, we are in constant communication around what that looks like. It is under constant review, but the 28th is still the 28th.
Very good. Thanks, guys.
Thank you.
Thank you.